College of Staten Island. My name is Nora Santiago. I'm an urban policy analyst here at CSI. It is my honor to host this year's GIS Day event virtually. 2020 has been a challenging year. The world is more interconnected than ever. Everything that happens in the world is so much closer to home. It is not just COVID-19, but other multi-challenging aspects of our lives. Our world is faced with deep-rooted issues such as racial equity, social justice, and simultaneously battling the spread of a global pandemic. COVID-19 woke up the world to the importance of understanding geography. Geographic information systems enables us to have a better understanding of the spreading of the virus and its socioeconomic effect on global sustainability. This is my 13th year hosting GIS Day on our campus. This year, GIS Day is very special to me because we brought two topics together that are very dear to me: sustainability and GIS. My Office of Sustainable Community Planning have been working hard to raise awareness of sustainability and to encourage students to make CSI green. I'm proud to announce that this year, we made the Princeton Review's Green Colleges list. My office had participated in various serious conversations about sustainability, especially after Superstorm Sandy. We used GIS to visualize the damage left behind Sandy and offered some solutions. President Fritz led the group of professors on campus using GIS to calculate Sandy and other future hurricane-type events and its possible effect on Staten Island. My office created the CSI COVID-19 dashboard using Esri's GIS dashboard to help visualize the devastating effect on our community caused by the pandemic. The disproportionate socioeconomic effect of the pandemic, deep-rooted systemic racism, is a serious conversation we are developing now. I'm so pleased to announce the first speaker today, the president of our college, William J. Fritz.
Well, I need to remember to unmute myself. so thank you so much, Nora, for that, for your remarks and that introduction. Good evening and welcome to GSI Day at the College of Staten Island. Just a little bit of history. The first known formal GIS Day took place in 1999. And Environmental Systems Research Institute president and co-founder, Jack Dengermond, credits Ralph Nader with being the person who inspired GIS Day. Nader considered GIS Day a good initiative for people to learn about geography and the uses of GIS. He wanted a GIS Day to be a grassroots effort and open to everyone to participate. The event traditionally is held the third week of November each year during Geography Awareness Week, a geographic literacy initiative sponsored by the National Geographic Society. GIS Day is a global movement recognized in dozens of countries. GSI Day brings universities, government agencies, schools, nonprofits, and GIS professionals together to build knowledge of GIS in their communities and to create understanding about the world we live in. This is the 15th annual GIS Day at CSI, and the event predates my arrival on campus, and I think it's safe to say that it's now one of our campus traditions. Our GIS Day will be focused on how GIS is utilized as a technological tool to address some of our society's most pressing issues, such as sustainability, systematic racism, and the pandemic. Some of the speaker topics will touch on the UN's Sustainability Development Goals and contact tracing relating to the COVID pandemic. I think it really speaks to the interdisciplinarity of GIS that I personally, as a geologist, as a field geologist, think of it as a geological mapping tool, which of course it is, but it does so much more. Of course, GIS is nothing more than a framework for gathering, managing, and utilizing data. In my work, the data comes from GPS-derived location data, as well as field observations, geochemical analyses that are performed in the laboratory, and the historical record. Just a bit about my own background and association with GIS. For years, I taught students how to make geologic maps in the field. They would spend 6 weeks scrambling over rugged ridges and mountains in southwestern Montana using Brunton pocket track transits and Adelaides to get accurate position and altitude measurement. As an aside, how many of you even know what an Adelaide is? The technology changes. I saw one hand. So the technology changes that fast, and really the GIS system has revolutionized. You know, with the advent of GIS and something called tough books, which were you know, fairly large, cumbersome, highly impact resistant laptops, along with you know, primitive handheld portable GPS instruments. The entire discipline in my course changed. And although in the early days, sometimes lugging around all of the primitive equipment was harder than the analog surveying equipment. But it really revolutionized how we visualize the three-dimensional aspect of the Earth's surface. Later, in the early 1990s, while doing field work in Jordan, I helped establish something called JADIS, J-A-D-I-S, which was the Jordan Antiquities Data Information System, which was an early GIS system. I was studying the transition from hunter-gatherer to farming in the Jordan Valley, which was driven by the drying up of glacial Lake Luzon and the resulting creation of new farmland, remnants of which are the Dead Sea and Lake Tiberias. The research depended on precise location and elevation information for each agricultural site. And the system was designed to accurately record each site with all the information unique to that locality in one giant database. Few maps existed, or they were highly classified by the military. And altimeters didn't work well 1,200 feet below sea level in the Jordan Valley. So GIS and GPS really helped us out. However, in the early days, it required a known base station that collected microsecond by microsecond data from the satellites, and then a real-time correction to data collected from bulky field GPS units. We had to collect data over long periods of time, correct that data based on the known location of the base station, and then use hours of runtime on the best computer we had to correct the data sets. And I had to, you know, both install the systems and write the code in some of that software. But the GIS presentation revolutionized our understanding of the early development and settlement of the Jordan Valley, and showed that exposure of new farmland by the receding lake drove agriculture rather than the innovation of new agricultural techniques. Following Hurricane Irene in 2011, I worked with Professor Ellen Venomoff and others on the team who are on the call tonight to model storm surges. Hurricane Irene was mostly a rain event on Staten Island, and many were relieved that Staten Island could, and we heard it said in the community, we can even survive a hurricane. However, Professor Venomoff and I felt otherwise and believed that we had dodged the proverbial bullet, as Irene had no surge and little wind. So we set out to model what a storm surge of 13 feet might look like, a number that we felt was reasonable based on historical records. There's been basically a surge of a 13-foot caliber in New York Harbor on the average of every 12 to 13 years since the 1600s. Our mapped view of such a surge looked eerily like the actual one of Superstorm Sandy in 2012. But to me, the real exciting thing and the theme of tonight's meeting is about GIS as a social equity driver that generates discussions on issues that we care deeply about at CSI. One thing we started to think about with the Superstorm Sandy event is, why did the surge of Sandy create so much damage? So Professor Benefoff's work with GIS made that clear by plotting the construction date of all homes in the coastal areas of Staten Island. He showed how following the 1938 storm surge, people started building in very vulnerable coastal areas, areas that were below sea level when they were first mapped a century ago, more than a century ago in 1900. They were below sea level then, and they're a foot or two below sea level now, and probably even more so with rising sea level in with the current state of global warming. It also showed how some of our most vulnerable populations are living in the most areas that are most susceptible to storm surges. So I still use GIS coupled with GPS data in my own research on storm surges. I probably even use variations of it when I fly my airplane. Accurate altitude, location, and speed driven by little boxes. So what took weeks of programming in the Jordan Valley is now routine and instantaneous, and is driving the whole flurry of research that we're going to hear about tonight and tomorrow night throughout the rest of the conference. So in closing, I hope you enjoy the rest of this conference. We have some impressive speakers lined up. And I'm now going to turn the program back to Nora Santiago to introduce our keynote speaker, Dr. Jeffrey Sachs from Columbia University. Thank you very much.
Thank you, President Fritz, and thank you for your continued support for GIS and for sustainability. Before we continue the program, there are just a few housekeeping rules I would like to go over. As you notice, everyone is muted during the event except the speakers. After the presentation, you will have a chance to ask questions. We will try to answer as many questions as we can. Please send your questions to me. You can direct message me in the chat. Just send it to Nora Santiago, and you can do that throughout the presentation, and I will read the questions afterwards. So I'm so pleased and honored to introduce our very special keynote speaker, Jeffrey Sachs. He's a world-renowned economic professor, a best-selling author, an innovative educator, a global leader in sustainable development. Mr. Sachs is a university professor and the director for the Center for Sustainable Development at Columbia University. He's a director of the UN Sustainable Development Solutions Network and the commissioner of the UN Broadband Commission for Development. Sachs has been an advisor to 3 United Nations Secretaries General and currently serves as the SDG advocate under the Secretary General Antonio Guterres. The New York Times twice called him 100 most influential world leader in the world, was ranked by The Economist among the top 3 most influential living economists. To me, he is the most important activist and leader for getting us all to understand what we got to know as the Sustainable Development Goals, or SDGs, as you will hear tonight. The global goals for sustainable development that we are using to guide our inspiration for the next 10 years. How GIS as a tool can help us track and measure where we are at any moment in time. Please welcome Jeffrey Sachs.
Nora, thank you very much. And thanks to CSI for inviting me and for making this the 15th GIS Day. That's really a great accomplishment and a great service to the students and the faculty, and to all of us who get to partake of CSI's leadership in this area. And I want to thank President Fritz for his wonderful remarks and his great research both on the origins of farming in the Jordan Valley, how incredibly fascinating, and on the safety of New York City and our vulnerability to storm surges, which indeed we are experiencing in an ever greater risk because of rising sea levels due to human-induced climate change. I have a wonderful colleague at Columbia University at the Earth Institute who was also modeling the vulnerability to storms before Hurricane Sandy, and he was saying how we will get flooded and how the subway system's going to be devastated. And so sadly, his own house was devastated by the flooding as a result of this. He saw it coming. He knew it was coming. It was a case where our knowledge gives us an indication of the risks that we're facing, but sometimes the politicians are not hearing. And unfortunately, that is often the case. And it's really maybe the theme that I would emphasize this evening. We have powerful tools and technologies to make the world safer and better, but we're not doing that with the seriousness of purpose that we should be. And we are, to some extent, recognizing the risks, but we still have to figure out the breakthroughs to achieve the solutions to these growing risks. Well, the world economy, we have learned over decades now, is able to produce wealth, but it is not able to do two very, very important things. One is to ensure that everybody in a society is benefited by that accumulation of wealth. And second, to ensure that the way we generate income and wealth is environmentally safe for us. In other words, we have a kind of engine of economic growth globally, not every year, certainly not in this COVID pandemic year, but we have a world economy that has tended to produce increases of output year to year, but it's not working to deliver what we really want, which is well-being and safety for the world. And of course, COVID-19 is a vivid, tragic, devastating example of this, in that just like the flooding from rising sea levels and increased storm intensity from global warming, the warnings have also been coming that because humans are disturbing nature, entering into new areas where animals harbor viruses or other pathogens that can be passed to human beings, we're experiencing at an increasing frequency new emerging infectious diseases, so-called zoonotic events, which means that a virus or a bacterium passes from an animal to human population. Of course, with COVID-19, the suspect is horseshoe bats in Southwest China. Somehow came into contact maybe with farmers in some way and created this new terrible scourge that the world is battling. Well, like the flooding, we were warned many times. Pandemics are coming, be prepared for them, be ready. And obviously we were dreadfully unprepared, and even more tragically, we've just spent almost an entire year of incapacity to mobilize a rational response to this, to the point where we have 240,000 plus dead, and the numbers just keep soaring. 1,700 new deaths yesterday, and we know that the curve is still rising, and we know that Staten Island is being really hard hit right now. So we're hoping for New York City to be able to weather this and bring this under control. Because of all these crises and governments aware of them but not solving them, in 2015, governments around the world got together to set some global goals to at least point us in the direction of solving the problems of rising inequalities and growing environmental threats and disasters. And in September 2015, all of the UN member states adopted 17 Sustainable Development Goals. The idea of those SDGs, the 17 of them, is to reset the way that the world economy works and that each of our national economies should work, as in the United States, for example, for us, so that we not only produce economic growth, but that it actually should benefit all of society, not just a small, rich part of society. So the 17 Sustainable Development Goals aim for economic improvement that is socially inclusive, as we say, or that leaves no one behind, and that also does that, supports that economic progress in a way that is not environmentally devastating. And those goals, the 17 of them, spell out that idea of socially inclusive and environmentally sustainable objectives. SDG 1 is to end extreme poverty. SDG 2 to end extreme hunger. SDG 3 to ensure that everybody has access to health care. SDG 4 to ensure that every child is in school. SDG 5 that girls and women have the same opportunities as boys and men, gender equality, and so forth. And the SDGs 11, 12, 13, 14, 15 focus on the environmental objectives of sustainable cities, which is SDG 11, and sustainable management of wastes and pollution, which is SDG 12, sometimes called circular economy. SDG 13 is climate safety by moving to zero carbon energy rather than the fossil fuel-based economies. SDG 14 is protecting the oceans. And SDG 15 is protecting all of the land biomes around the world. Two other goals that are very interesting. SDG 10 calls on us to reduce inequality of income, and SDG 17 calls on us to cooperate globally. So putting all of this together, it's a wonderful picture of the kinds of changes we need in the world to make a better world. If we actually achieved the goals that the governments have set, by very nature, we would have a fairer society, because the goals precisely say everybody, no matter what race, no matter what class, should have access to the basic goods of life, or what we sometimes call the human rights of economic goods, established in the Universal Declaration of Human Rights already 72 years ago, that everybody should have health care, everybody should have access to social protection, to shelter, to an adequate diet, to education for children. All of these were promised, but they haven't been delivered. Well, we agreed on all of this in 2015. I'm sorry to say our government, this current administration, mercifully leaving office, thank God, in my view, did not pay attention to these objectives during the past 4 years. Our inequality of income has increased. Our environmental degradation has increased. President Trump, just like he said, the virus will magically go away, said it's going to get cooler, don't worry about climate change. And it's about the same level of ignorance, I'm afraid, that we've been devastated by this pandemic because he didn't know how to respond to it. And we are being devastated by climate change because he doesn't even want to know about it and pretends instead that it doesn't exist. So where does GIS come into all of this? GIS comes into all of this because if we're going to achieve these goals, we have to understand the world that we're living in. And if we want to have environmental sustainability, we need the maps that President Fritz talked about. We need to understand the physical geography of the planet, the dynamics of Earth systems, whether it is climate or land use or extreme events or forest fires or other kinds of land degradation. If we want to control diseases, we need maps of how the diseases are being transmitted. What are the networks for COVID-19? What are the pandemics? If we want to ensure that children are getting a decent education, we need to know where they are and are not in school. And of course, I say it today that the mayor has closed down the New York City schools again, at least the physical presence. But how many of our kids won't be able to access school because they don't have connectivity at home to be able to access classes online? We need to understand that, and it's a geographic issue that we need to understand. So even though I am trained as an economist in the tradition who learned when I went to school that countries are organized in alphabetical order because we didn't look at maps. We didn't have GIS tools when I trained. We didn't really understand how geography shapes economics. We now know that everything about the dynamics of an economy, just as with the dynamics of a biome or ecosystem or climate system, has a strong geographic dynamic and logic to it. We now have powerful tools to use that mapping to help guide our state of knowledge about where we stand with these goals in comparison with where we want to go. And Esri, of course, is the great hero of this story. Jack Dangermond thought about GIS at the start, brought it from his graduate school training and created Esri and brought GIS tools to the world. And I was thrilled to hear that the first GIS day was suggested by Ralph Nader, because that's very much in the spirit of using data for improving our knowledge and our ability to solve problems. So this idea is a very powerful set of tools for the Sustainable Development Goals. If you'll let me share my screen, I just want to close by telling you about an initiative that Esri partners with and makes possible, together with National Geographic and together with Columbia University and the United Nations Sustainable Development Solutions Network. And I hope we can get CSI into this particular activity, because you guys have so much you could add to this, which would be fantastic. The idea is to curate and promote real-time data, GIS data, to help guide the implementation of the Sustainable Development Goals. That's the idea. So we have a website called SDGs Today, all one word, and I'm going to try to share my screen, and I hope we can do this, and I hope you can see that. Do you see that? Good. So this is a website called SDGs Today. You will be able to find it easily. And it uses Esri's technologies, and it's organized to show real-time SDG relevant data, which is now being collected with increasing frequency. Of course, most of us look day by day at maps of where the epidemic is. For example, this kind of map, which shows the daily confirmed cases for this page is November 14, when the US was one of the hardest hit countries of the world. And because of the improved, wonderful networks of data collection, for example, the World Food Program, which won the Nobel Peace Prize this year, has to collect basically real-time data of food insecurity. So SDG 2, about food security, we now have, if I click on it, a daily map that is brought to us by the World Food Program, where one can hover over any part of the world. Syria, as of this is actually November 18, 6 p.m. It was last edited. The World Food Program estimates that approximately 51% of the population is now living without sufficient food intake, a disaster. And the idea is that with that kind of information, we should be mobilizing to a much greater extent than we actually are, food relief or emergency funding or ceasefires in the case of conflict zones and so on. We have from, in this case, Global Forest Watch, nearly real-time information. I don't know if you can see that, but here is Sumatra and in Indonesia. We have real-time information on deforestation, which is absolutely critical information, especially for monitoring illegal land use, which is so devastating to biodiversity and to even our carbon management targets. We have weekly measurements for SDG 16 on where conflicts are taking place, so violent outbreaks. I don't know if this map will come up in time. I'm probably a little bit slow. Oh, here we are. Well, you'll have to take my word for it. There we go. This is real-time data where if I hover over any of the circles, I can find information for violent conflicts during this past week, which is part of the goal for peaceful societies for SDG 16. So what I'd love to invite for all you specialists of GIS is we are interested in promoting your data that are SDG relevant to help bring to the attention of the media, policymakers, scholars, specialists, the kind of SDG relevant data, whether it is on hunger or daily conflicts or deforestation, or of course we can get air quality basically by the hour around the world. The current status of women in government, which of course changes by the day in terms of parliamentary representation and so forth, but we have a daily update on that. The pandemic information and so forth. But the idea is that this kind of real-time data can help us to hold governments to account, can help us to understand the dynamics of sustainable development, and can help us to manage crises, such as the very dramatic crisis of COVID-19 that we're living through. One final point that I want to make in closing is that these SDG data, whether it's on hunger or schooling or poverty or violence, need to be looked at from the lens of social justice, because different parts of our community, of course, in the United States and around the world, suffer the indignities or the life-threatening realities of disease or hunger or poverty or violence at very different rates. And part of our work at the UN Sustainable Development Solutions Network is to understand those inequalities, because a fundamental purpose of the Sustainable Development Goals is social justice. So I did want to bring your attention to one more study of the SDSN in addition to SDGs today. It's a report that we put out about a month ago now called Never More Urgent. And if you look up SDSN and Never More Urgent, you'll find this report. It is a disaggregation of the US position vis-a-vis the Sustainable Development Goals on poverty, hunger, lack of access to health care, children out of school, and so forth, disaggregated by race and ethnicity. It's a very dramatic story, of course, because in almost every aspect of ill health, poverty, environmental injustices, we see that African-American populations, Hispanic populations, people of color in our society are really having a very, very difficult time with the discrimination, with the poverty, with all of the barriers that communities face. And the data are presented in this report because we want the SDGs to be a tool for social justice, and they can be a tool for social justice. Let me conclude first by, again, thanking the College of Staten Island for its leadership. I'm excited that we can, I hope, build some strong linkages going forward with your GIS expertise and interest, which is absolutely fantastic. Let me also say that I hope you will join me in enthusiasm for the Sustainable Development Goals as a moral framework for our society and for the world in moving forward in the coming years. You may not have heard enough about them because we've had a government in the last 4 years that was not attuned to social justice. By some accounts, and I'm among them, the opposite of that. But I believe that we're moving to a new time, a new administration, and a new direction. And this is the time, in my view, not only to stop this devastating pandemic, but to build the future that we called for in the Sustainable Development Goals, one that is socially inclusive and environmentally sustainable. And I hope that CSI and Columbia University and the UN Sustainable Development Solutions Network can work together, and that we can use these powerful GIS tools to help us get there. Thank you very, very much.
Thank you very much, Professor Sachs. It was a wonderful introduction to those of people who actually probably don't know about SDGs. And it's nice to see the connection, how GIS can help us. So now we're going to get to the good part, the questions, right? This is what everyone loves. So I'm going to call the questions in order I received them in the chat. So as I'm asking the questions, feel free to add more questions to the chat. So the first one for Professor Sachs is, it says, I appreciate all your thoughts on global changes, but we have challenges right here in New York City. I will be speaking tomorrow on inequality as it relates to transportation services. New York City has yet to prioritize transportation for all. And we have massive inequality in the provision of transportation services across New York City, with massive transit desert in eastern Queens, southeast Brooklyn, and Staten Island, and no plans to change this situation. I guess I'm asking how we mobilize the world for change when we cannot even get consensus for equitable investment inside our own city. We just built a subway extension in the richest and widest part of New York City, the Upper East Side, and that took up most of our transportation improvement dollars.
Very good. So we need your advice and recommendations and modeling to understand what we should be doing. I think part of the goal of our scholarship and of universities is to put forward visions of what we should have and what we could have. And again, I think on transport, GIS is probably the most powerful tool we have for modeling the kind of future that we want. Now, I would ask the question, and I'm very interested in the question, how changes of technology are going to affect the kinds of mobility and transport that we need in the future. I'm a believer that we are going to have a very different kind of life and structure in a digital era. Of course, a lot of people have discovered that they don't have to go to the office every day, and that's going to continue past the end of this pandemic. We don't want to be at home all the time, but the idea that we are in long commutes to and from offices, I think is going to change tremendously because of life, at least partially online. We'll have much more blended lives. Commuting will change. The patterns of commerce are going to change because e-commerce is, again, not just a fad, but it is a technological advance in many ways. Not all of one way or another, but it's going to change the dynamics of freight delivery, the kind of vehicles in the city, how we want to organize. It will change shopping and retail, how streets are used. And then a third change that I'm fascinated by is how we will use vehicles in a different way with autonomy of vehicles, which of course technologically has already arrived, but questions of safety, design of streets, of traffic flow, of preparedness for electric vehicles in general will take many years to resolve. But I would like to hear from you as someone calling for transport justice. What should New York City look like, or what can we expect plausibly a good life in New York City to look like in 2035 or 2040, when we are more digital, when maybe our e-commerce is coming almost autonomously, when our work patterns and our commuting patterns have changed, as I think they're very likely to change? What should the design of our streets, our public transport, our bicycle and walkways, our neighborhoods look like? When you have the answer, or even if you don't have the answer, if you have some thoughts, send them over to me. No one has the answer, but if you have a vision of them, please, I want to know a lot more about that as well. But you're asking the kinds of questions that we should be modeling. I like to complain also about all the injustices. I do like to point out that there's so much wealth in New York City that it's not really a shortage of funding. After all, we have the highest concentration of billionaires on the planet in a very small part of our urban geography. We ought to be able to do more. And with the more clarity we can show the what to do, how to do it. And by the way, just let me add, in your model of transport, make sure that it's compatible with the safe, with the clean energy and a safe climate, because that's also another absolute constraint that we need to build into the future of mobility. But the more clearly we can show the what to do, I think the more chance that we're actually going to do that.
Thank you. Our next question, are the SDG goals attainable without integration into the domestic politics of UN member nations? That is to say, in the US case, as platforms plank of both major parties and the parties of other democracies.
The SDGs are absolutely multi-stakeholder in that they must be political, they must be incorporated into civil society, and they must be part of the business environment. And in the United States, it's a pretty fragile toehold right now. They are not deeply embedded anywhere in our society. This is part of our politics of the last few years. I would say, sadly, it's part of our politics of the last 25 years. We somehow lost the knack of problem solving in American society, and we have to regain it. Once upon a time, we would have said, we have a big crisis, climate change. What are we going to do about it? And maybe if it was President John F. Kennedy, he would say, I say that by the end of this decade, we get to a zero carbon power grid, just like he said we should go to the moon by the end of the decade of the 1960s. But we don't have that kind of bold problem solving right now, but we need it. And the question is absolutely apt, which is, in the absence of that kind of national commitment, these are not self-fulfilling goals. And therefore, we are not on track. We strangely had a government in the last 4 years that deliberately wanted to move in the wrong direction, especially on fossil fuels, out of vested interests, politics, confusion, who knows what. But in any event, rather than decarbonizing our energy system, Trump wanted to hyper-carbonize our energy system. We're going to hear something quite different from President Biden, that's for sure. Now, I can tell you, I used to travel beyond the front door before COVID started. And in many parts of the world, other governments are rather deeply committed to the SDGs. Europe, the 27 countries of the European Union, have adopted what they call the European Green Deal, which is an integrated program for decarbonization, for reducing pollutants, for sustainable land use, and for digitizing the European economy. It's really an impressive set of policies, and it's the kind of thing I hope we're going to get in the United States as well. So I'm not bereft of hope, but I do agree with the questioner that this is really a major political challenge that so far is unproved and unmet in our country.
Thank you very much. Next question, given all the challenges facing our country today, which SDGs, in your opinion, should our incoming president prioritize in the next 2 years?
Well, first SDG 3, which is health, because we have to stop the pandemic. And other parts of the world have stopped the pandemic. In the United States, weirdly enough, face masks became a hyper-political issue. This is kind of crazy. Whereas in other countries, people wore face masks. There was good trust between government and the public, and the epidemic was suppressed in Korea or Australia or New Zealand and several other countries in the Asia Pacific. There's hardly an epidemic going on. It's so different from the United States. So that's the first priority. The second priority is then to start building back. We're going to have high unemployment, people who need help, social services that need delivery, infrastructure that needs to be rebuilt. And the key is to have a plan so that when we do start building back, it's along the dimensions of sustainable development. It's ensuring that the poor and the excluded are included. And it's ensuring that we are moving to a low pollution, sustainable land use, zero carbon emission economy. That's going to be a 30-year process of transformation, but it has to be carried out starting now with new kinds of investments in energy and in infrastructure. So I believe that it's a two-step process. Stop the pandemic and then start the rebuilding, but along the lines of sustainable development.
Thank you very much. One more question. This is a light one. Can we download SDG data sets to use on QGIS? I assume they're asking for SDGs Today website, the data sets that are.
So most of those data sets are accessible and downloadable. And our team at the Sustainable Development Solutions Network can also be contacted because they're working together with the originators of those data that can give you some tips or some access. And of course, Esri has an amazing thousands and thousands of layers of data in the Living Planet series. That's just the most astounding GIS repository that exists. So please use these tools and then come up with new solutions and come up with the new real-time data harvested through big data and other means, or through process satellite imagery and so forth, that we can use to increase our capacities to focus on the SDGs.
Thank you very much. No more question, but just a very nice statement. I would like to read it to you. It states, first and foremost, thank you for Jeffrey Sachs for giving us such an honest conversation about sustainability and social justice. It's great to see that we have global leaders and institutions working hard to make the world sustainable and equitable. So we just want to thank you. It was great to have you. You made this event very special, and we appreciate answering all those questions, and hope you can stay around. We will have some questions at the end if you can answer them.
I would love to, but I'm actually going to have to get off because I have to be on another another Zoom shortly. But let me thank CSI. Thank you, Nora, for your leadership, and thanks to everybody. Don't be distant. I'm Sachs at Columbia.edu. We're neighbors. Let's think about how to carry out all these goals together. I'm really grateful, and thanks to everybody. Have a wonderful discussion.
Thank you so much. We appreciate the time.
Bye-bye. Thanks a lot.
All right. So our next presentation will be one of our very own students from the geography department, Dale Henderson. And he will discuss the topic of policing in New York City.
Hi, how's it going, everybody? Yeah. Can you guys hear me?
Yep.
Everybody can see my screen?
Yes.
Okay, awesome. So my name is Dale Henderson. I'm a senior geography major at the College of Staten Island. My research this semester looks at geographic policing patterns and community policing tactics in New York City, and how they have been impacted by the emergence of technological policing platforms. The platform in question that I'm going to be looking at is called CompStat 2.0. So here we can take a look at CompStat 2.0. It's an interactive platform meant for the community, and if you click on these crime statistics, you can pick the name of the crime, the year, and either the week, 28-day, or year to date. I'm not going to click on any of the big numbers because it takes too long for them to load. And you can see the distribution of these crimes, and that can be very useful for the citizen to know like what sort of crimes are happening in their communities or the communities that they're going to. And it's also used by NYPD to inform their policing tactics and methods. So what my research is going to do is we're going to be deconstructing the CompStat 2.0 website to consider factors that are maybe outside of the raw boil cut data. So this issue with this data is that it boils down communities and individuals into simple numbers and crime statistics, which can adversely affect historically overpoliced and racially marginalized communities. My first map shows all the crimes committed under the description of robbery. The yellow dots show Black people who were arrested for robbery, and the blue dots show white persons arrested for robbery. And as you can see, the blue dots are much more much more sporadically distributed, whereas the green dots are having high concentrations in North Brooklyn, the Bronx, and East New York, which are historically Black communities. And now arresting for robbery isn't necessarily a bad thing, but this high police presence leaks into less consequential crimes such as marijuana possession. So this map here shows white persons arrested for marijuana possession in New York City. And so you're seeing a big concentration in South Brooklyn. Manhattan's a difficult area to analyze because so many people are moving through Manhattan on a daily basis, so many tourists, commuters, and things like that. It doesn't really give us a great idea of residentials, but you're seeing a big concentration in South Brooklyn, and it's pretty sporadic throughout the rest. In this map, again, we see the same pattern that we saw in the robbery arrests. We see a big concentration of arrests, and this is for Black people arrested for marijuana possession 2014 to 2017. We see a big concentration in North Brooklyn, East New York, and the Bronx again. So that high level of policing that's a result of the perception of, or the reporting of violent crime in communities is leaking into non-consequential crimes such as marijuana possession. And so this is where we get to the concept of over-policing, that these communities are being very heavily policed, and in some ways it's helping them by addressing violent crimes, and in some ways it's putting a lot of people in prison or into compromising legal situations for crimes that are not crimes in other states, like marijuana possession. So some of the questions that I'm looking to answer in my research are, can we police communities for violent crimes without over-policing them for inconsequential crimes like marijuana possession that aren't even crimes in other states? And is a quantitative approach to policing causing police institutions to compromise their community involvement and understanding of the issues plaguing high crime communities? So like, are we able to address high crime and also then address less consequential crimes to create a more healthy community? And is the use of technology aiding us in that, or is it hindering our ability to? And then here is just some number data that's represented on the maps, because it can be very tedious to count all of these little dots to get the numbers themselves. So if you want to read through that, you can. Right here, you'll see that there's a much higher rate of Black people being arrested for all of these crimes across the board, and that is because your communities are being policed at a much higher rate for all of these crimes. If you have any questions, feedback, or advice, you can send me a message here on Zoom, or you can email me at dlh2779@gmail.com.
Thank you very much, Dale. It was a very nice presentation. I appreciate
Thank
you
you.
coming today.
Thank you for having me.
All right. I'm so pleased and honored to introduce our next speaker, Sdg Garrity. She's a Chief Medical Officer at Esri, developer of the world's most powerful mapping and analytics platform. Esri, right? The company who made ArcGIS. She heads Esri's worldwide health and human services practice and is passionate about transforming health organization through a geographic approach. Previously, she was the Deputy Director of the Center for Health Statistics and Informatics at the California Department of Public Health. There, she engaged in statewide initiatives in meaningful use of health information exchange, open data, and interoperability. While serving as an associate professor of clinical internal medicine at the University of California, UC Davis, she conducted research on geographic approaches to influencing health policy and advancing community development programs. Garrity is an author of numerous health and GIS peer-reviewed papers and book chapters. She has lectured extensively around the world on a broad range of topics that include social determinant of health, healthcare strategy and market development, access to care, opioid addiction, privacy issues, homeless and public health preparedness. She received her medical degree, master's degree in health informatics, and a master's degree in public health from UC Davis. She is board certified in public health and is also a geographic information system professional. So please welcome Sdg Garrity.
Thank you very much. Happy GIS Day, everyone. All right, well, I really do appreciate having this opportunity to talk to you about using GIS to address today's public health challenges, which are extensive, obviously. But I do want to recognize for a moment GIS Day and wish you all a great celebration. I think this activity tonight is a wonderful way to start the celebration. And at the same time, I want to acknowledge, since I'm talking about public health, what a challenging and difficult and quite remarkable year this has been. Now, maybe you have found it a little bit ironic that this has all happened in the year 2020. And I'm sure you've all seen the memes where people are sharing their frustrations about this challenging year, likening 2020 to a four-letter word. But today, to the extent that it's possible, I want to look at something positive, how GIS has brought increased clarity to our lives in ways that help us to better respond to the pandemic, and also, I hope, help enhance our future resilience. If I were to put this very simply, I would say that GIS helps us to go beyond collecting the dots, something, by the way, that health organizations are very good at. And it lets us connect the dots using place and location analytics that creates new insights and new information that helps to inform action. So imagine for just a moment what things would look like this year without GIS. Well, case and death data might be collected in spreadsheets or stored in PDF documents. Now, certainly there would be the additions of visualized data with graphics. There's no question that those can really help us to make greater sense of the data and improve our vision and our clarity and the ways that we connect the dots. But it just doesn't hold a candle to the way that geographic information puts data into context. It shows us how places compare, what the trends are in the short term and in the long term. Geographic data provides something special that helps us to understand patterns and relationships and use that information to more intelligently respond. And the world started to take notice of how well maps contextualized data early on in this pandemic. Thanks to the Johns Hopkins University dashboard, the world really woke up. That was said earlier, this idea of waking up and paying attention to the evolving outbreak. JHU collected the dots, and they continue to do that to this day. Their dashboard has solidified its place in history as the most viral map-based application in the world. One thing that is so important about their dashboard is that from the very beginning, the Hopkins team made sharing their dots, the data, a top priority. And this one move enabled all kinds of organizations to connect the dots through their visualizations and their analytics and their scenario plans, and it enhanced decision-making for localized COVID-19 response. Now, this happened around the world. A few examples here include dashboards from Peru and from Hong Kong and Iraq, as well as Nigeria and Italy. And the idea just took off, and each place designed their dashboard slightly differently to provide what was the most relevant information for their populations. Now, COVID-19 affects different people differently, and we've seen governments applying GIS to understand those differences, to detect gaps in services or in health outcomes, and to take action to improve health equity, whether we're looking at people who are dependent on electricity just to stay alive, or we're looking at places where civil unrest overlaps with high case counts. It has been really critical to identify vulnerabilities of all types so that mitigation measures can be taken in the right places. Now, many organizations used analysis to perform capacity forecasting. In this example that you're seeing, models are able to pull in hospital bed utilization data, and then they combine it with social distancing behavior information, and they start to be able to understand what might happen over time with local hospital bed capacity. Because of course, every hospital and every government needs to be able to predict whether their curve is going to stay flat, maintaining that health system infrastructure and the ability to care for each and every person who comes through the doors, or if some hospitals may become overwhelmed and exceed their capacity to provide the needed care. Now, it turns out that two staples of geographic problem solving are site selection and calculating the geographic accessibility for places. Now, these methods have been used during COVID-19 for things like standing up new testing sites, distributing food resources in communities that need them, and extending the healthcare services in places where hospital capacity actually does become overwhelmed. So we do this with a process called location allocation. So I want to walk through an example. Let's say that we want to stand up new testing sites. We would begin by determining the population demand, or if you're a health person, you're going to say the population need for this new service. And we can do this by overlaying all of the factors that are contributing to each of the 5 COVID risk types. So those are transmission risk, socioeconomic risk, susceptibility to the disease risk, exposure risk, and resource insufficiency risk. So in the end, with all of this information, they combine and they create a risk ranking that you can quantify over small geographies that you're interested in. Maybe it's neighborhood level. And so to calculate the best testing center locations, you pull in all that information that you just calculated, and then you add in road network data so that you can put together reasonable access parameters like driving distance or drive time to get to these new testing sites. And then you also add any kind of constraints you might have, like maybe you only have a budget to site 10 new testing centers, or maybe your staff is limited and you can only staff 5 new testing centers. No matter what your constraints are, the model pulls in all of that information and considers it in the calculation of the most optimal sites from the entire population of options that would be available. So let's say you did it. You stood up some new testing sites. Well, then you've got to get people to those resources. So how do you do that? Well, you do it with resource locators like this one that actually came from Valencia in Spain. So with this, a user can place a pin on the map, whether they're using a tablet, a smartphone, or they're at home with their PC. And they can learn about where is the nearest hospital or pharmacy or social services or testing sites in the area. So I think there's really no question that we have seen through COVID-19 a great innovation in trying to connect the dots to support the response to the pandemic. And actually, going a step further, we saw GIS used in the large-scale COVID-19 testing that was done recently in Slovakia. Now, they aimed to test their entire adult population over 2 weekends in October. And GIS provided residents with up-to-date wait times. And that data put on dashboards helped people to self-distribute among all of the different testing sites, and that regulated the overall occupancy at each site. It was really a win-win for everyone. And actually, if you keep an eye out on Google, I'm publishing a blog about this maybe tonight, maybe tomorrow morning. So you can watch my social media or Google it, but Slovakia did great work using GIS. So now I'm going to take a few minutes to dive deeper into 2 strategic COVID-19 response activities that are going on right now: contact tracing and planning for vaccine distribution. So as you probably know, contact tracing is a process that health departments perform actually all the time, but in general, the idea is to help break the transmission chains before an infected person has a chance to spread their infection to other people. I actually became a certified contact tracer so that I could really understand this whole process. And so we've put together a solution where we're using GIS to help health departments collect and manage their contact tracing data, to do rigorous analytics, and to evaluate their overall processes. So let me walk you through some of this. What you're seeing on screen now is a sample contact tracing form. In the exposure information section, I blew that up for you on the right. It asks questions like, have you traveled domestically in the last 14 days? And if you, as the person being interviewed, says, well, yes, I have, then the contact tracer is asked to fill in what state you went to. Well, I know for this audience, it's pretty obvious that states are large areas and that level of location just is not going to be very useful. So we've developed apps that make gathering finer scale location information, as well as collecting the information for all of the other questions, really easy to do. Now, once the data are collected through our apps or any other way, health professionals are going to need to be able to perform analysis. And I think this is especially important for COVID-19 because a lot of the viral spread happens by community transmission. And actually, we coined a new term for this kind of analysis. We're calling it community contact tracing in recognition of that location component in this kind of a situation. So what it all means is that people who get sick can't always identify how or by whom they've become infected. And so we start with the locations that we've collected in our contact tracing interviews. And we can then take that information, even if it actually came to us from a simple spreadsheet, and we can put it on a map. And that marks a very beginning step in our spatial analysis. Well, then the first analytic function that we might decide to perform is very simple density analysis. And that's visualized here as a heat map. That could provide very early clues about higher risk locations. The spot that's lighting up for you on this screenshot is an example of a nursing home. So then we would go deeper in our analysis. We would move on to link analysis. And that's going to give us a better understanding of person-to-person connections that really are the traditional focus of contact tracing. And we can use the same tools plus graph theory that helps us to determine the strength of person-to-person to place connections that are so important in community spread. Well, we can also use dashboards as a way to evaluate and improve the contact tracing process. By monitoring how we're doing, we can help with identifying and coaching contact tracers who maybe aren't keeping up, or we can hire new contact tracers if the workload is the overall problem. Or maybe we can even identify other bottlenecks happening in our system which could impact its efficiency and its effectiveness, because timing for contact tracing is probably the most important part. So you've got to keep an eye on the process and you've got to be efficient. Well, looking to the future and hopefully the very near future, we can use GIS to support efficient and equitable vaccine distribution. Now, there are some very complex and challenging issues in this effort that GIS can nicely support, like identifying the facilities that can store and administer vaccines, determining where concentrations of high priority populations are, and exposing gaps in access to vaccine, formulating plans to reach everyone. GIS can help manage and monitor the vaccine administration and inventory system, as well as share progress on vaccination delivery across our communities. So let me show you what some of this looks like. One of the key tasks that health departments need to figure out is how to prioritize vaccine delivery in a way that ends the pandemic as quickly as possible. It's what we all want. Now that means considering vaccinating healthcare workers on the front lines first. Makes perfect sense, right? We have to preserve the healthcare infrastructure. Then we want to prioritize other populations in consideration of those most likely to suffer severe disease, like our older adults, those most exposed, like the essential workforce, and those most likely to transmit the disease, like those who are living in congregate housing like nursing homes or university dormitories. GIS can make this task quite a lot easier. Now, once you know where the critical populations are, and perhaps you've done some of that location allocation that I talked about, so you found the very best vaccine venues to administer the vaccine, well, at that point, you are able to calculate the reach of those vaccine venues. How many of the critical population can be served by each of your locations? And it's inevitable that there will be gaps. We know this. Some populations are going to be out of reach of the vaccine venues. So we can make plans to site new vaccine venues and see how well we can then serve that underserved population. We can also partner with locations that already exist, like retail pharmacies or independent pharmacies who may be able to support a broader distribution for difficult to reach populations. And of course, we can plan drive-through vaccine clinics, walk-up clinics, and mobile outreach efforts to ensure that we get vaccine to everyone who wants it. Our fourth key task is about tracking and managing the vaccine inventory, along with the vaccine distribution kits and the PPE inventory. You need all of them to deliver vaccine. Well, you're going to see this combination multiple times, right? Easy to use mobile tools connected to dashboards, you'll see that. The mobile tools can actually read the barcodes that come on the vaccine cartons, and they can parse the information in that barcode and put it into relevant fields, like the quantity that is contained in that carton, the lot number, and the expiration date. Now, this makes inventory check in and check out really quick and easy. And all of this movement of the supplies is again monitored in the real-time dashboards. And that helps with things like ordering new vaccine when you see your supplies getting low, or making sure that you are using vaccine doses before they're expired, trying to avoid waste when we know we have such limited supplies. Now, as this enormous global challenge continues to evolve, it'll be important for decision makers to constantly evaluate this process and the productivity of each of the vaccine venues. And I personally think that it's going to be equally important to share vaccine progress with the public using community hubs. We'll also need to consider strategic communications within our communities to build trust and provide resources and deliver information that can combat vaccine hesitancy. Now, in this infographic, we're including for individual and even custom locations, information about language preferences, marketing channels that are used by the community. Like, do they get their news and information from a newspaper or cable TV or from their smartphone? We can learn what kinds of social media applications people in communities prefer, and we can get a sense of the composition of the community through the different types of job categories they have. So why is this so important to have this kind of marketing profile information? Well, it's because there is a lot of vaccine hesitancy at this point in time in America. According to the Kaiser Family Foundation, 34% of Americans are not planning to take the coronavirus vaccine, and that attitude is even stronger among people of color. So what are the issues? Well, if we compare the two donut charts that I have here, concerns are about safety and the lack of trust. For example, the Black people who were surveyed were not confident about the safety of the vaccines, and they doubted that the needs of Black people had been considered in the testing and approval process. So one interviewee noted, and this is a quote, "If African Americans, Hispanics, and Native Americans are told to get vaccinated first, it will be interpreted as you want Black people to be the guinea pigs." The fact is, there is a long history that fully supports mistrust of the health system by Black people and other people of color. And if we're going to communicate effectively, we need to understand that history. So I want to transition to explain some of the influence of geography on creating structural racism and how we can use geographic solutions to make progress in achieving racial equity. I won't, however, be covering that long history of abuses that have occurred through health systems and health research. That definitely does deserve its own focus. Now, at a high level, I'm sure you've heard that when it comes to health, your zip code matters more than your genetic code. Now, it turns out that this is a statement from Tony Eichten, and it became the Forbes Healthcare Quotation of the Year in 2013. This has been restated many times over. You may have said it yourself if you're a GIS person. And it was really meant as a way to shine a light on the fact that our geographies, our context, the places where we live are critical to our overall health outcomes. Excuse me, a long day of talking. All right, well, that concept in the health world is directly related to the social determinants of health. Now, that is a framework that describes the circumstances that are shaped by unequal distributions of money and power and resources at every geographic level. Now, the public health community has learned to specifically look for the social determinants of health because they create disparities, and they are able to look across the breadth of economic indicators, social supports, the built-in natural environments, healthcare access, and educational attainment. Now, it may seem like a natural move to talk about racism simply as a component of the social determinants. However, I would encourage calling out structural racism specifically to recognize and be able to address the systemic underpinnings that continue to exist in our society. So how did geography contribute to these dysfunctional systems across America? Well, we might begin with the Great Migration, which was beautifully written about by Isabel Wilkerson in her award-winning epic story, The Warmth of Other Suns. She describes the massive internal exodus of nearly 6 million Black people who fled the South in the early 1900s in search of a better life. People left the rural areas to find economic opportunity in urban cities, to obtain better resources like healthcare, to escape the limitations of the Jim Crow laws, and to protect themselves from lynchings and massacres like Rosewood. Well, this geographic redistribution of the population dramatically changed the composition of urban areas across the country, leading to the next shift, the so-called white flight, in which white families moved away from the urban areas and into the suburbs. Well, then in 1934, with the National Housing Act, there was an introduction of the 30-year mortgage with a low fixed interest rate, and that provided an opportunity for lower income people to be able to afford new homes. Now, as a risk mitigation measure against potential default on these new mortgages, the Homeowners Loan Corporation, or HOLC, created what they called residential security maps to grade neighborhoods. Now, this practice has become known as redlining, and it happened all over the country. You can see the legend in the upper right corner of this slide. So an A grade in green was given to upper or upper middle class white neighborhoods. B grades in blue were still desirable areas populated by US-born white-collar workers. They were considered really a sound investment for mortgage lenders. Now, the areas in yellow with a C grade were considered declining. Residents were generally working class and maybe foreign-born. In red, we have the D grades. Those areas were considered hazardous because according to HOLC, they were infiltrated with undesirable populations such as Jewish, Asian, Mexican, and Black families. Well, banks received federal backing to lend money for these mortgages based on these grades. And so many banks simply refused to lend to areas with the lowest grade. making it literally impossible for people in many areas to become homeowners, even though there was actually no greater risk of defaulting on a loan. So where have these historic insults left us today? Well, not only are many segregated urban areas in decline with substandard housing and fewer neighborhood amenities, but we have a generational effect as well. As you know, home ownership is the major way that Americans create wealth. And so subsequently, discrimination in the housing practices became the major reason that Black families up and down the income scale have a tiny fraction of the family wealth that white families do. So take a look at the bar graphs on screen by McKinsey and Company. They're showing that Black families are far less likely to receive an inheritance at all. And if they do, the value of that inherited wealth is only about 35% of the value that white families receive. Now, redlining practices impacted long-term opportunity as well through the educational system. It's a vicious cycle. Property taxes provide the majority of funding for public schools. People in more valuable homes have better funded schools, better paid teachers, better school facilities, and more resources, which then contribute back to higher property values of their homes. So what's the result? Communities of color disproportionately occupy lower paying, service-oriented jobs, and in this time of COVID-19, may be less able to socially distance, and it puts them at higher exposure risk. We can also see how redlining practices led to increased health concerns for communities of color. Urban planning generally benefited richer, whiter neighborhoods. So people of color were more likely to live near industrial plants and be exposed to toxic fumes and pollutants. They're more likely to have reduced access to fresh food and drinkable water, leading to higher incidences of asthma, certain cancers, and heart disease, which is then compounded by higher travel burden to access healthcare services. For these reasons, it's easy to see how Black people in particular are often more likely to be exposed to COVID-19, to develop more severe disease, and to die from COVID-19. So, how can geography help as we try to move forward? Well, first, we can engage our communities to better understand the local problem. The example of the Minneapolis Mapping Prejudice Project is, I think, compelling. This effort took a historical look at the covenants in property deeds that forbade the selling of homes to particular groups. They scanned 1.4 million deeds from 1900 to 1960, and they looked for words like Jews, Japanese, Negro, Mongolian, and colored. They found 25,000 suspect deeds, and they recruited 450 community volunteers to validate the records and help map them. The goal is to change the way that residents view race and space and the history of both of those in their city. Now, the second strategy is to map and analyze inequities. Where do members of systemically disadvantaged communities reside? Can those communities readily access needed resources like healthcare, virus testing, broadband, and computers for virtual schoolwork? By weighting and overlapping multiple indicators, an evidence-based approach to citing new resources in the places where they're needed most can be achieved. And I was interested to hear the question from for Jeffrey Sachs about transportation, because there was a great example of this happening in Chicago this year, this analysis to make progress. So the Transit Authority had to reduce stops on the public transportation system since the decreased ridership due to COVID-19 meant decreased fares that fund the system. But they recognized that many of Chicago's transit-dependent residents are essential workers, and they continue to utilize public transportation to get to their jobs, and of course to grocery stores and their doctor's appointments and other places And so the Transit Authority analyzed all sorts of demographics, and they used the CDC's Social Vulnerability Index to preserve the services for those who needed it most. So here you're seeing the pre-COVID RTA stops on the left, current RTA stops on the right after that analysis. Now, the third strategy is to operationalize best practices, and that begins with simply collecting foundational data. If the data sets don't exist, you got to make plans to capture information through surveys or other tools to get at issues of lived experience within the community. And then you ensure that your metrics create visibility around racism by disaggregating the data along racial and ethnic lines. And that's what you're seeing in this COVID-19 dashboard from Milwaukee County, showing cases and deaths from COVID-19 for each group. The fourth and final strategy that I'll mention is to manage performance. Dashboards help executives track key indicators, right? And to make strategic decisions, including investing in geographically targeted and tailored ways. So this example is simply showing how a government might seek to align their workforce to the local community demographic makeup. And they can do that not only as a whole local government, for example, but also by each department and program to make sure that they're as aligned as possible. And we certainly want to support everybody's work in this area. And so we're offering a Racial Equity GIS Hub, which is a free resource. It has over 100 data sets, including all of the historical redlining data that I talked about. There are guidance documents, focused learn lessons, so you can learn GIS in this context of racial equity. And there's even the ability to request urgent GIS assistance through our disaster response program. You know, it's an incredible year and so much has been done, and there is so much more to come. I know I'm preaching to the choir here when I say it's really never been enough to simply collect the dots. We need technologies like GIS to help us to connect the dots in ways that inform and inspire and instigate changes that will make all of us healthier. And so I think that together we can make all zip codes healthy zip codes. And I want to thank you for your attention.
Thank you so much, Esty. This was wonderful. Thank you for wrapping it all together and how GIS can help us to solve these problems. So now we are moving on to the last part where we give the chance to the audience to ask questions. So please put your questions in the chat if you haven't done so, while I'm starting to read some of the questions that arrived. All right, let's see. All right. What data collection gaps have been exposed by the current pandemic?
By the current, what was that? Pandemic?
Yes.
Okay. Well, I think the Johns Hopkins University dashboard certainly showed us that people, well, there's lots of, gosh, where to start? The data, first of all, the data has not been interoperable, right? It was really hard just to collect the cases, and they're scraping so many different websites and pulling from so many places. They have a team of 20 people doing this full time to get the data that populates that dashboard. I mean, you may not realize it, but that's a lot of effort for the simple dashboard that you're looking at just so we have the data. So just case and death data has been difficult to put together in one system. So, and then even the quality of that data, how do you define a case, has been constantly evolving, and people are talking about what that means. So, so that's another challenge. But I think we've also seen things like in the very beginning, people didn't even know how many hospital beds, staffed hospital beds we had across the country, much less ICU beds or how many ventilators. I don't know if y'all remember that in the news all the time, but nobody seemed to have that data. But actually, one company did have the data. That was Definitive Healthcare, and we partnered with them to make that data available to everyone. And so then we needed the data on who is actually in the hospital with COVID-19. And that was something that Secretary Azar required every hospital to report, or a hospital could report to public health, and public health would report up so that it could be included in the HHS Protect dashboards. So you can take a look at those dashboards to get the information. But that was a process as well, right? Nobody had really simple systems where they could report their data up and provide a cogent national picture. So I would say that we have major problems with what sounds simple, but it's very complex. That's data sharing practices. Everybody considers data their own asset, and I'm going to hold it and not give it to anybody. And then we use HIPAA as an excuse. Privacy is very important, but we overuse it beyond what is required by the law. And then there is also the lack of interoperable systems that has caused a major data challenge for getting that data from one place to another and providing a authoritative resource for everybody. So thank goodness, I would say that Johns Hopkins filled that gap, and hopefully they've inspired the rest of us to come together and make the system stronger for whatever happens next.
Yeah, thank you very much. I had first-hand experience how hard it was to get data in the beginning in New York City. Everything was provided in a PDF, not even a spreadsheet. So we went through the struggles. Now it's a lot better and more
and I
accurate.
should mention too that people hadn't been, and some still aren't, disaggregating the data by age group and by race, ethnicity, other kinds of metrics, so that we really can understand those population vulnerabilities and gaps in resources or health disparities that are cropping up. So we discover those when it's far later than it had to be.
Exactly. All right, the next question is about vaccine distribution. How can you ensure that the available vaccines are distributed to the critical populations rather than just those with the most money or power?
That's a great question. And I'll kind of approach that from a couple of levels. So where this question worries me the most is on an international level, because I think that it is the countries with more money, more resources that are going to get a greater share of the vaccine. There is the World Health Organization is working with Gavi, G-A-V-I, to try to put together these policies and guidelines to make sure that there is a more equitable distribution of vaccine for all countries, no matter the resources. But this is a big struggle, because none of us are well until all of us are well. None of us are safe until all of us are safe. So there is an international problem with that. In the US, I hope that it's not a problem in that people will be able to just buy separate vaccine, or organizations can buy separate vaccine. I do believe that we have a national process for distributing vaccine. All of the states have already submitted their distribution plans, trying to figure out how many of each of these critically prioritized phased populations they have. So that, when we look at phase 1A, which includes healthcare workers on the front lines, every state has estimated how many of those they have. And while I think there won't be enough of the vaccine to even get all of the health workers on the front line immediately, we'll get through that group and we'll go to the next group, which will be older adults and then people with comorbidities, essential workers. So as we work through that process, I think it'll go, well, I don't know how smoothly it'll go, but I think the process is meant to work well. Here's where my concern is, and that is that healthcare personnel are, incredibly altruistic, and they have a different hat on than public health people. Public health people look at population needs, and healthcare people look at the needs of the person in front of them. So what I wonder, and I haven't really heard if there are safeguards against this, is if somebody comes in and, it's like my patient and they want a vaccine, I might be tempted to give them the vaccine, even if it's not their turn in the prioritization. I think those kinds of things could happen, but everybody's being very well educated, and I hope that when it happens, it's a rarity.
All right, thank you very much. There is one more question regarding a distribution. If your office is currently working with current government or future government on the distribution process. I don't know if you could say anything about that.
So I could say maybe a little bit about that. We have been in conversations at literally every level of government in the US and outside of the US. And we are offering our help to assist in this process. We know it's an incredibly geographic process. And so while I can't say who and where, I will say lots of conversations across the board because there's a recognition that geography can help.
I'm glad. That's wonderful to hear. So that will be our event today, unless there's more question. Let me just look at my chat. No, I think that was the last question. So I just want to thank you all, and thank you, ST, for staying longer and answering all these questions. And thank you, everyone who attended GIS Day. Thank you for all the speakers. Jeff left already, but Dale, thank you. You're still here. I would like to thank the administration for their support, President Fritz, Robert Wallace, who is our VP for Economic Development, Continuing Studies and Government Relation, Jasmine Cardona, our Executive Director, and most of all, Ishmael Hassan, who provided all the technical support, marketing, and graphic design, which was essential elements for this event. I hope you enjoyed today's event. I just want to let you know that there is day 2 because one day is not enough for GIS Day, so we need a day 2. So that's tomorrow night, same time, same link at 6 p.m. We will have 3 wonderful speakers and 2 student speakers who will talk about racial equity, social justice, and GIS. Have a great night, everyone, and I hope to see you all tomorrow. Happy GIS Day.